Welcome to RAAONLINE. Myself, Dr. Rahul Agrawal, and we have started a course that is known as DNB Rapid Revision courses. So, in these DNB Rapid Revision courses, we are mainly focusing the course for the ongoing practical exams and theory exams for the DNB students. This lecture will also help the MDM students who are going to appear their university exams. Second thing is that in the DNB, there is also an exam known as FAT or formative assessment test. So before going to the formative assessment test also, the students can refer this type of lectures. We are trying to cover every chapter, every aspect of the anesthesia, which can be asked as a question or which can be asked for the in the OSCE, and which are also required to learn the basics of the anesthesia. So most of the corporate hospitals, most of the medical colleges, and nowadays most of the tertiary hospitals also have their DNB courses. During DNB courses, the student takes admission to the DNB courses, and for the 3 years the students should be trained in the institute. Besides this, the students have to give 2 exams, mostly the theory and practical, and you have to pass both the exams, theory and practical. And in the subsequent years, we have seen the pass percentage of the DNB anesthesia is on an increasing trend. But in most of the institutes or in most of the center, it is seen that the students who are not able to or not known, or they are very much unknown about what to read to pass the exam. Anesthesia is a very vast courses, and how to read for the theory exam, how to read for the practical exams, what are the questions that can be asked in the OSCE, what are the long cases, what are the short cases, what are the viva stations, how to approach the 20 OSCEs in the exams. There was always a fear in the mind of the DNB trainee peoples that whether they will go on passing the exam or not, and there was so much of headache in the DNB curriculum. The students have to do a thesis, and sometimes the thesis has been not accepted by the NBE due to so many faults in the thesis paper, and they are again returned back to the students. So they have to again revise it and again send it. And also this DNB anesthesia theory question papers last 5 years or last 6 years, sometimes the question comes from the outside of the syllabus, and some questions are also the DNB students cannot answer in the paper. Second thing, the DNB questions are sometimes lengthy also, but it is not actually lengthy. It is our understanding that these questions are very much lengthy. We write so much on an exam. So how to, we give different practical tricks and tips in the courses so that the student can easily answer their theory paper, and how to write in the theory exam to get a good mark. Suppose there are 3 to 4 types of students, A, B and C. There are 3 types of students, same question. Suppose they have to ask a question, write about supreme LMA, write about LMA supreme, or suppose write about an endotracheal tube, simple. Suppose endotracheal tube, 5 marks question. So one student draw a diagram, level the diagram and finish it. That is okay. One student go on writing literature, everything. One student write about what are the types of ETT, what is the definition of ETT, what is the use of ETT. So like this. So here there are 3 different types of answer to a particular question. But now here the examiner will give good marks to the student who have drawn a diagram and who have leveled the diagram, because the examiner wants to know about the endotracheal tube. They have not asked the question about the advantage, disadvantage, what is the definition of endotracheal tube, like that. So here in the lecturers or in the courses, we already put the slides or we already put the notes regarding the previous year questions, last 5 years, 7 years questions with their answer. We are already giving it, and also in between the lectures we are also guiding the students how to write a question. Suppose a question comes for anesthesia consideration of malignant hypothermia. Anesthesia consideration of a pregnancy patient posted for emergency LACS having preeclampsia or eclampsia. Like this, the anesthesia questions are already, most of the time it is asked in the paper 2. Sometimes in the paper 4, it is mostly about the recent advances. Sometimes they put, in our exams, April 2023, they ask about oxygen concentrator, because at that time, just COVID has been over and all that. So oxygen concentrator we have not read anywhere. Just on the fundamental basis, we have written oxygen concentrator, but some center there is no oxygen concentrator, so the students are not exposed to the oxygen concentrator. I am giving the example of oxygen concentrator, but there are so many other devices also. Just like ECMO, we have not exposed to ECMO. In our center, we don't have any ECMO. But when we are posted for a practical exam to another center, ECMO is a short note for us, short case for us. ECMO is a short case for us. So it is very difficult to answer which you have not exposed or you have not seen. So we are trying to actually give a visual perspective, in a diagrammatic perspective of everything in this whole lecture. This whole courses are only to make easy the DNB practical and theory exams. We are trying to put as much as OSCE question possible in this our DNB exam courses, so that the student can pass easily their practical exams. Because OSCE, if you will pass, and OSCE if you score good marks, then you will definitely pass in the exam, because OSCE will be evaluated by the NBE, and also there are specific question to answer in the OSCE question. Suppose a question came, suppose LMA Supreme is a diagram, and what are the structures ABC, what are the structure in the LMA Supreme. So if you write what is ABC, you will get the full marks. Second, LMA Procil sometimes also asked, sometimes ETCO2 is also being asked, sometimes about the biomedical waste management it is asked. So there is a pattern for OSCE, which they are repeatedly going on asking biomedical waste. Every year one question is from biomedical waste. So the students who don't have any their seniors in the institution, they are the hospital recently offered the DNB anesthesia course. The students are in very much doubts that what to read before exam. So before 6 months or 7 months you are going to read this chapter, or before you are taking these courses, or in first year or second year if you are taking these courses, you can easily make your own notes. You can easily come to understand or come to know which questions are going to be asked, what are the questions asked in the last 5 years or 6 years. We have divided the question as per the chapter basis. Suppose in neuro anesthesia 20 questions has been asked, we have put it the whole 20 questions in the neuro anesthesia chapter, and we are trying to solve each and every question through our lectures. So once you download our notes, you can easily able to write all the 20 questions answer in the neuro anesthesia chapter. So likewise, every chapter we have our theory questions and practical questions and OSCE questions along with their solutions. So the NB pattern, the theory exam of the NB pattern is like that. They have 4 papers, maximum of 100 mark each. The whole answer or the whole marks is around, the total marks is around 400 marks. Out of 400 marks, you have to secure 200. If you secure 200, you have passed the exam. You have passed the exam. So how to secure the 200 marks? How to secure these 200 marks? Paper 1, paper 2, paper 3 and paper 4. There are 10 short notes of 10 mark each. Sometimes the question came of 10 marks, sometimes the question came for 5+5. In nowadays, in recent from 2023 onwards, they try to put question 5+5. Question 1, A, B, 5+5. ANOVA, 5 marks. LMA Supreme, LMA Procil, again 5 marks. So 10 marks. Okay, 1 and 2. Also, the number of papers in the theory paper is limited. So how to write the answer within that specific papers? You are going to appear the FET exam, you will experience that. But how to write and how to cover everything related to that question in a single paper? How to do a good flowchart? How to try to do a good table? Try to put a good diagram. So in which question you have to put a diagram? In which question you have to write a table? That all has been discussed in these lectures. Number of short notes and their respective marks weightage may vary in some subject in some papers. Maximum time is 3 hours. Here the NB is somehow putting some grace mark when the candidate score about 192. They give a 2% grade mark, that is 8 marks, and the student pass. So you have to score 192. But 192 is not our target. Our target is around more than 300. If you target for more than 350 or 300, you can score more than 280 or 300, like that. Your target should be very much larger. And suppose, and it is not a big deal to pass the theory exam. In the last 5 years, suppose you are going on, if you are reading in first year and second year, is very much good. But suppose you have 6 months to the theory paper, it is very 6 months left to appear the theory exam, and you start preparing now. You have to read the 5 years, 7 years questions. If you are able to solve all the 5 years, 7 years question of last 5 years and 7 years, it will be very easy to you to pass the exam. First of all, you will acquainted how the question is being asked, and second thing, you will be also acquainted that which area of the chapter will be going on asking about maximum theory questions. Only the candidate who will clear the theory exam are allowed to give the practical exam. So in practical exam, we have a maximum 300 marks, so totally 700 marks, theory plus practical. And in practical also you have to score more than 150. And in practical exam there is no provision of any grace marks out there. In the theory paper we have a grace mark of around 2%, that is 8 marks. But in practical exam there is no grace mark. Once you clear the theory, that is in the first attempt, you are giving 3 chances to attend the practical. Second and third attempt the practical exam shall be permitted out of the next 3 sessions of the DNB final exams. So this is the pattern for the practical exam. See the virtual OSCE, site or OSCE is the main motto to pass the exam. 20 OSCE station, 5 marks is. So out of 300, 100 marks is for OSCE, that is around 33%. If you score more than 80 or 90 in the OSCE itself, you can easily score more than 60 or 70 in the practicals. Out of 200, you can easily get the 60, that is 30% mark you can easily get. 60 marks or 70 marks you can easily score in the rest of the long case, short case like that. So 2 clinical cases examination, 50 marks each. 1 long case 50 marks, 1 long case 50 marks. Long case is all about only basic concept. In the long case, they will mostly going on ask about the basic concept. Suppose they have put a thyroid gland as a long case. Your history, whatever history you will tell, it will score you around, suppose from the 50, there is a 5 marks or 6 marks to when you write the history or when you properly tell the history. So it is in your hand. Second thing is the examiner will try to find out or try to know about the basics of the thyroid. Suppose the physiology of the thyroid hormones or how the thyroid hormone is synthesized, how you will examine the patient of thyroid, why thyroid is very much important for anesthetist, what is the airway concern in the thyroid patients, what are the post-operative complications. Suppose if you are able to answer this type of questions in the practical exams, you will definitely go on crossing the 50% level. Suppose 50 marks is for long case, easily get the 20-25 marks like that. And if you are going to, or if you are able to do the difficult question answer, then you will definitely score higher. So OSCE is the main fundamental here. OSCE is in your hand. If you properly prepare for the OSCE, you will definitely go on passing the exam. 4 word rounds of 10 marks is 4 viva voice. Word rounds, sometimes they keep different short cases. Cleft lip is a question. Obesity is a question, ECMO is a question, NIV is a question, ARDS is a question. Suppose so sometimes they will post it to the ICU, sometimes they will post it you in the ward. In the ward you will see there is small diabetic food ulcer. So diabetic food ulcer is a short question, 10 marks. Sometimes the patient is having hypertensive, severe hypertension, 10 marks. Suppose the patient is having cleft lip and cleft palate, 10 marks. So these small cases they will give in the 4 word rounds, 4 viva voices. 4 viva voices, 1 viva voice is all about equipments, LMA, endotracheal tubes, central line, spinal catheter, epidural catheter, spinal sets, epidural sets, everything, brain circuit, they will keep everything in the one station. Second station is the mostly in the machine they will keep, One station is for drugs, one station is for PFT, LFT, ABG and all these things. And one viva station for ECG and like that, CT scan, they can ask anything. So there are 4 viva voice station, 50 marks each per viva station, there is 60 marks and 4 word rounds. So in the 3 years of journey, you are exposed maximum to the practicals exam. So OSCE, it is okay, we have to prepare it, but long cases it is you must have exposed in your during the 3 years of training, you must have exposed to these long cases. Thyroid is a long case, pregnancy is a long case, obesity sometimes they keep as a long case, femur fracture posted for PFN or like that, femur nailing they will keep as a long case. Suppose person is old age, TKR, long case, so they will go on asking about the physiology of geriatrics there. So they will not keep any new cases. Most of the cases you have seen in your 3 years of training, but you have to read it. They will not ask about how to give a spinal. They will not ask like this type of question. They will ask about the physiology of geriatrics, physiology of pediatrics, what are the anesthesia concern in case of obesity. So you have to go on to the basics of the chapter. Nothing new in it. Sometimes some questions are very new, I also appreciate, but these are very few. They will not hamper in passing or fail in the exam. You will definitely go on pass on the exam if you basically read for 3 years around 3 to 4 hours per day every day. If you go on reading for small concept, you will definitely go on pass on the exams. And before going to the practical exam, the main thing is OSCE. Before going for the theory exam, everything is important. Statistics, most of the candidate leave statistics, but statistics always repeat question. P value maximum time it is asked. And statistics always carry 5 to 10 marks in the theory paper. So statistics never leave statistics. Physiology, first paper, second paper, physiology and cases, you will definitely get good cases. Obstetrics, they will definitely go on putting 1 questions. Fractures, orthopedics, geriatrics, they will definitely go on putting 1 questions. One lung ventilation or from the pulmonary excerpt, they will definitely go on putting 1 question. Thyroid, they will definitely go on putting 1 question on theory paper. So like this, malignant hyperthermia or neuromuscular disease, definitely go on putting one question. Drugs, mostly some new drugs, Sugammadex, they will definitely go on put. If a new drug is invented, go on reading this type of drug, definitely it come in exams. So it is like that only. Guidelines, ACLS, BCLS guideline, all airway difficult airway society guideline, yeah. Suppose that DAS guideline of intubation, extubation, this everything is important. ACLS, BLS guideline, bradycardia, tachycardia, arrhythmia, blocks, everything is important. So, and there is one station for this ACLS and BLS also in the practical exam. So it is very much important. So it is NBE. NBE defines NBE separated first year, second year, and third year to different objectives, but no, we never follow all this. So suppose in the first year you are not able to do a intubation, or whenever you are putting a endotracheal tube, it is always going to the esophagus. When you are putting a spinal, you are not able to get the CSF. So the next day the students or the candidates are become very panic. What to do? I am not able to do all this. So see, NBE is having only single objective. ASA grade 1, grade 2, spinal and G. That's enough for first year. If you are not able to put a central line, if you are not able to put a arterial line, PA catheter is very big thing. If you are not able to put a arterial line, if you are not put a central line, don't worry. Because you have 3 years for the procedures. 3 years for the procedures. Focus on ASA grade 1, grade 2. Just you are able to give the spinal in the first year after completion of the first year, then is very much okay. In some institutions, we have first year, second year, and third year everyone. So suppose a second year comes or third year or senior comes to give a spinal in ASA grade 1 treatment, don't hesitate. It is nothing to worry about it. You have 3 years to do the procedures, and after degree there are so many cases, there are so many advantages. You can do ASR in good institutions, and you will expose to different type of cases. So don't worry or don't run about after procedures. Go on learning the basic physiology and pharmacology in the first year. In second year also they will post you in the OMFS, ENT, ICU, ophtha, like that. But in the third year you will expose to that super surgery or super specialty like neurosurgery, cardiac surgery and everything. So in first year, if you are going to for a cardiac cases, or you are going to see or going to observe a cardiac case, you will fear it. So no need to worry about, man. You have 3 years to expose different type of cases. And in most of the institutes, they have not every department. Some institutes like onco anesthesia, some institutes like open heart surgeries, some centers like neurosurgeries. So if you are not exposed to this type of surgeries, don't worry. But in suppose in a center, or you are going to give a practical exam in a center outside your center, outside your state, and in that center you are you listen that no, there is cardiac surgery going on. So how I will answer the cardiac surgery cases? Examiners are not like that. If your center is not giving you, or you are not exposed to cardiac surgery cases, then also if you are getting a essay of MS, then you can answer the physiology of MS. Na? It is not required to, or they will not going to ask about the simple steps of the cardiac surgery. They will ask about what is the fundamental of MS, what you will do in MS, what are the hemodynamics you will maintain in MS, like this. So don't worry. NB to pass theory and practical exam is very easy. Only thing is that you have to read from the first year. The day one of the joining to the institution, you have to read. Try to focus physiology and pharmacology in a greater depth, and try to cover all the guidelines related to difficult airway, related to that ACLS, BLS protocol in first years. Try to gain concept regarding to the different regional nerve blocks. What is the whole concept about the pulmonary physiology, cardiac physiology, about the pharmacokinetics and pharmacology of the different drugs. In the second year, you are going, you go on reading about the specialty in the cases like blood management, what is massive blood transfusion, what is ATLS guidelines. Second thing, about the different specific cases, like what is the special cases in obstetrics, what is the special case in cardiology, like this. In the third year, you go on reading super specialty. You will definitely go to give a good marks. And always choose a thesis chapter or thesis topic that you can do easily. Don't go on choosing thesis topic which are very much complicated and it takes so much of master chart, so much of statistics, like that. You don't go on doing such type of thesis. And another thing, try to attend all the conferences, try to attend all the airway workshop, try to attend all the hemodynamics workshop. You will definitely go on learn so many things. So this is our main motto for the courses for first year, second year and third year. And also in this series of the DNB rapid revision courses or DNB courses, we will try to cover everything possible aspect from us whatever material we are trying to or we try to provide, we will provide to you, so that we can make easy to pass the theory and practical exams. Fine.